Hi, my name's Tracey Bell, and today I'm going to demonstrate a very natural lip enhancement using what we call the MD codes by Allergan. In, for example, Karen's case, Karen has a very thin upper lip. However, Karen doesn't want an unnatural look. Therefore, what I'm going to do is I'm going to use today 0.5 5ml of Juvederm Smile. The product is developed specifically for the lip, and I will show you a very simple procedure that will take us probably around about 10 minutes to do. I always say to the patient, you will get a little bit of swelling straight after the procedure. There is always a risk of bruising, but it will give you a very natural result. Okay, so on Karen, I'm going to do the lip area only. I have a syringe of Juvederm Smile. With the MD codes, we are split into what we call LP2, LP1 and LP3. What that does is it will reduce the periorals or the smoker's line. The LP1 will basically promote a little bit of natural augmentation, and LP4 will promote lip augmentation also. So again, I come just lateral to the vermilion border, and again, normally 2 injections, very small amount of product, and we come along and we reduce these lines. LP2, I use 2 injections, I come down, I come up, and that's what we call LP2. We go back again to LP3, so again, just outside of the vermilion border, because I don't want to turn the lip out. I'm going to come down, and I'm going to augment. Now, what we need to do with Karen, she's got a very thin upper lip. I'm going to come in, you can do this with a cannula as well, and I'm going to go into what we call LP1, and I'm going to inject 0.1 of Juvederm. Right, on the left, in again, 0.1. I always tell the patient as well that this may feel a little bit uneven, may feel a little bit lumpy straight after, that's normal. The product also will produce a very slight swelling because it's hydrophilic, i.e. it collates water. So if we look, I've used in total 0.45 on the upper lip. Now again, if we look at the lower lip, Karen has lots and lots of perioral lines. So what I'm going to do here, I'm going to come outside the lower lip. You okay, Karen?
Mm-hmm.
And we're going to come along. And we're going to come along. So can you see? I'm actually in the white part of the lip. And again, to reduce. Okay, so that's my 0.55. I'm then going to swap the syringe, and I'm going to use another. How do you feel, Karen?
I can't feel anything.
Okay, and again, Karen can't feel anything because I've already given her a block. So that means I have gone within the mouth and I've put a tiny bit of anaesthetic in order to make the lip augmentation using the MD codes, less painful. Okay, Cami. Okay, so this is a second syringe of Juvederm Smile. And again, I'm coming along the outer border we're reducing the perioral lines. Now Karen also has a little bit of loss of volume in this area. So what I want to do, I want to come into the corner of the lip, into the body, and I'm going to fan down to take out what we call, and this is all done with very, very small needles. Again, on this side, I'm going to come in, border of the lip, in and out, always remembering that Karen wants a very natural appearance. I've got 0.2 of the product left, and on the lower lip I'm going to go into LP1 and LP1 again. So we're going to do 0.75, 0.75, and 0.5, 0.05. Okay, and that will produce a very natural appearance for a lady of Karen's age. And I think that it's very important that when you do a lip enhancement or definition or volumisation, you have to listen to the patient. It's important that not every lip is treated the same. Less is always more. And I would always as well advise that if you were in the process of rejuvenation, that the lip is always the last part of any facial anatomy that is treated. Karen, how was that?
Absolutely fine. Didn't feel a thing.
Okay, perfect.
Okay.
So that's a lip enhancement with Juvederm Smile. Again, very natural. The patient will probably have a little bit of swelling for 48 hours. I would always review in normally 2 to 3 weeks. And the product I would expect to last about 6 months. Again, every lip is different, yeah, depending on age, race, and patient's needs really. So it's important that you listen. And thanks for watching our video at Tracey Bell.